गजवदना गणनाथा गजवदना विनायका गजवदना गणनाथा गजवदना विनायका गजवदना गणनाथा गजवदना विनायका गजवदना गणनाथा गजवदना विनायका सिद्धिविधाता शिवतनया सिद्धिविधाता शिवतनया सिद्धिविधाता शिवतनया सिद्धिविधाता शिवतनया बुद्धिप्रदायक गजानना बुद्धिप्रदायक गजानना बुद्धिप्रदायक गजानना बुद्धिप्रदायक गजानना पार्वती नंदन भवभयभञ्जन पार्वती नंदन भवभयभञ्जन पार्वती नंदन भवभयभञ्जन पार्वती नंदन भवभयभञ्जन युग युग वंदित जय श्री गणेशा 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 गजवदना गणनाथा गजवदना विनायका गजवदना गणनाथा गजवदना विनायका सिद्धिविधाता शिवतनया सिद्धिविधाता शिवतनया बुद्धिप्रदायक गजानना बुद्धिप्रदायक गजानना पार्वती नंदन भवभयभञ्जन पार्वती नंदन भवभयभञ्जन युग युग वंदित जय श्री गणेशा 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 गजवदना गणनाथा गजवदना विनायका राम लक्ष्मण जानकी जय बोलो हनुमान की 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 अंजनी पुत्रा बल भीमा आंजनेया बल भीमा 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 बल भीम बल भीम बल भीम बल भीम बल भीम बल भीम बल भीमा बल भीम बल भीम बल भीम बल भीम बल भीम बल भीम बल भीमा बल भीम बल भीमा बल भीम बल भीम बल भीम बल भीम बल भीम बल भीम बल भीमा परति पुरुषा साई रामा पावन पुरुषा साई रामा परति पुरुषा साई रामा पावन पुरुषा साई रामा साई राम साई राम साई राम साई राम साई राम साई राम साई रामा साई राम साई राम साई राम साई राम साई राम साई राम साई रामा साई राम साई राम साई राम साई राम साई राम साई राम साई रामा साई राम साई राम साई राम साई राम साई राम साई राम साई रामा राम लक्ष्मण जानकी जय बोलो हनुमान की।
Om Sai Ram, ladies and gentlemen. On behalf of the Sai Medical Unit, I would like to welcome you to this Healthy Aging webinar today. We offer this at the feet of our Divine Master, Sri Satya Sai Baba, whose love and guidance has made this possible. My name is Ayushi, and I have the privilege of being your MC today. Before we begin today's event, it is important that we recognize the traditional owners of this land and give our respects to elders, past, present, and emerging. Members of the Sai Medical Unit include health professionals, allied health professionals, and volunteers. The Sai Medical Unit of Australia provides free health workshops and free medical camps in Australia and Fiji. We have some amazing and inspirational speakers lined up for you today who have kindly offered their time and expertise to put this program together. We thank them for their love and dedication with this selfless activity. Please note that the health information provided today is of a general nature, and we recommend that you contact your health practitioner for more personalized health advice to suit your individual needs. Dr. Yogesh is formerly from Fiji. He studied undergraduate medicine in India, MBBS, and worked in Fiji for 3 years. His specialist qualifications are in emergency medicine, FACEM, and pediatric medicine, DSH, from New Zealand and Sydney, respectively. Currently, he's working at Redlands Hospital. He will share some of his knowledge and experience with us today so that we can be empowered and better protected as we age. His topic is stroke. Think fast, early recognition and prevention.
Welcome and greetings. My name is Yogesh Natali. I work as an emergency physician for Queensland Health at their Redland facility. The nature of my work involves regularly seeing patients presenting into the hospital with stroke. And so I thought it was appropriate that I choose a topic looking at not only the recognition of stroke, but also stroke prevention. Right at the outset, I'd like to say that stroke kills, that one person in Australia dies every 19 minutes with stroke. And so by the end of this talk, you could assume that someone would have died from stroke. I have sort of prepared this talk taking slides and information out of the Stroke Foundation website. I'd highly recommend that you visit that. There's quite a bit of information on that website, and the Stroke Foundation this year celebrates 25 years. So there's two kinds of stroke. By far the most common stroke is the ischemic stroke. The second most common is the hemorrhagic stroke. An ischemic stroke is a stroke that happens as a result of a clot occluding or blocking the blood flow into a part of the brain. While a hemorrhagic stroke is when one of the blood vessels on the surface of the brain ruptures and there's blood into, or there's bleeding into the substance of the brain. The ischemic stroke and the hemorrhagic stroke are both very similar in the sense that they deprive brain cells from oxygen and nutrient, and this leads to the death of these brain cells and the manifestation of the stroke. Therefore, stroke is a medical emergency that requires immediate medical attention. When not enough blood goes to a certain part of the brain, these cells, like those of a cardiac cells, die within minutes. While other cells of the body, like the muscle cells, the liver cells, skin cells, kidney cells, have some time to survive without the blood or oxygen, the neurons of the brain, or the brain cells themselves, only survive a few minutes before they die. Furthermore, brain cells, much like the cardiac cells, are irreplaceable. Once these brain cells have died, then they cannot be replaced. This is why, like the heart attacks, stroke is an emergency and needs immediate attention. Strokes in Australia are one of the biggest killers. There's more women dying of stroke than of breast cancer, and more men dying from stroke than prostate cancer. But we can work on this. Stroke, as much as 80%, are preventable. And if we go through and understand and follow the instructions that are laid out in the Stroke Foundation or laid out by the Stroke Foundation, then we can easily see the incidence dropping from what we have now to a much more acceptable figure. Here are more facts about strokes in Australia. In the year 2020, there were 27,500 new first-time strokes. The cost to the economy is equivalent to something like $6 billion. People in the regional areas are more likely, 17% more likely to suffer stroke than in the metropolitan cities, given their timely access to medical care or medical expertise. Having said all of that, it is heartening to see that over the last 10 years, the message from the Stroke Foundation and from the medical specialty has been getting through. There has been a small but a significant drop in the stroke numbers. One of the key reasons for a drop in the number of stroke is the education around stroke recognition. The Stroke Foundation has come up with the abbreviation FAST, F-A-S-T. F stands for face, A for arm, S for speech, and T for time. Look at their face and look for any facial asymmetry, a facial droop, the inability to smile normally or show their teeth. Then look at their arm and see whether they can lift their arm, whether they can lift both their arms and hold it up in the air for you. Hear their speech. Is their speech slurred, or are they able to understand you? So if you've got a yes to any of these questions, facial asymmetry, weakness in the arm, inability to talk, or a slurred speech, then you are concerned enough to call 000 to have these patients seen, transported urgently to the hospital for treatment. Remember, brain cells are dying without oxygen and nutrients, and so time is critical. This slide is again to remind you the abbreviation FAST stands for face, arm, speech, and then an urgent phone call to the emergency services, or T for time. Therefore, remember FAST, recognize FAST, and act fast. The next two slides are to show you what exactly happens at the hospital. That on arriving at the hospital, we have the opportunity to use a drug that would burst the clot that's blocking off the artery to the brain, called thrombolysis. And we've also have an opportunity, a very popular treatment these days, is to get you to a center where these clot that is blocking off the vessels to the brain these clots can be retrieved. We have techniques that can be put into place to retrieve or unblock these vessels. But what's important is to get these patients into hospital early enough for these interventions to be put in place. Having recognized stroke and through your 000 number having sent the patient into the hospital for further assessment and treatment, I now ask the question, how do you prevent stroke? Prevention of stroke often means recognizing the risk factors. Queensland Brain Institute, or QBI, recognizes risks of having a stroke as physical inactivity, high cholesterol, high blood pressure, irregular heartbeat that we call atrial fibrillation, and smoking. Surprisingly, a small group of patients can get stroke without any of these traditional risk factors. Stroke can strike at any time. Physical inactivity has the highest risk for stroke, and therefore the highest benefit can be got by addressing this. So again, the two most important areas where we can make changes to prevent strokes are physical activity or exercises and good nutrition. The Stroke Foundation suggests that as much as 56% of all Australians do not do the recommended amount of physical activity. That's about 2.5 hours per week. This equates to almost 10 million adult Australians. Further, they say that as many as 15% of the population do no exercise at all. The recommendations for the 18 to 64-year-old age group is at least 2.5 hours of moderate intensity exercise per week. Moderate intensity is defined as exercise where your heart rate increases but you don't get breathless. They also sort of suggest muscle strengthening exercises and to take regular breaks from long sitting times at work. The recommendation for the 65-year plus is that 30 minutes of moderate intensity exercise per day. And this can be cumulative, meaning that you could break down the 30 minutes into 10-minute intervals. The exercise regime can be further supplemented with healthy eating habits, where on a medium-sized plate one can have the appropriate proportions of vegetables, carbohydrates, and proteins. Mindful eating is a beautiful concept of thinking about your food, slowing your eating, enjoying the experience of eating without distraction, at the same time recognizing the internal signals that tell you that you are now full. Well, finally, what is my take-home message after this brief talk? I'd say take home two things. Number one, recognize FAST. The abbreviation FAST stands for face, arms, speech, and time to call the Queensland Ambulance Services. Remember FAST, recognize FAST, and act fast. My second point would be to reduce your risks for cerebrovascular accidents or strokes by regular visits to the GP, exercising according to recommendation, and mindful eating. Thank you very much.
Thank you, Dr. Yogesh, for such an informative talk on strokes today. We will now hear from Dr. Aishwarya Nair, who will be discussing preventative health checks. Currently, Dr. Nair is working as a junior doctor at Princess Alexandra Hospital. Dr. Nair is also an associate lecturer at Griffith University Medical School. She obtained her Doctor of Medicine at Griffith University and has several awards attached to her name despite her youth. We are grateful for your input, especially with the hectic schedule junior doctors are faced with. Thank you.
Hi everyone, I'm Aishwarya Nair. I'm a junior doctor at the Princess Alexandra Hospital, and today I'm very happy and humbled to be presenting at the Healthy Aging webinar. I'll be discussing 2 health checks that you can do with your GP quickly and easily to take small steps to prevent big problems later on. So the first one is the health check targeted towards age 45 to 49. This is for individuals with a chronic disease risk factor. A chronic disease is anything that's including but not limited to conditions like asthma, cardiovascular illness, diabetes, cancer, arthritis, or any musculoskeletal conditions. A chronic disease is typically a disease that lasts 6 months or more, and the risk factors for these diseases can be divided into 3 categories. So lifestyle factors, medical factors, and family history. So lifestyle factors include whether you smoke or not, your physical activity level, your alcohol intake, and your nutrition. And medical factors include your cholesterol level, your weight, your whether you have a very high weight, your glucose levels, and your blood pressure. And as I mentioned, a family history of a chronic disease also plays into this. So what does this health check involve? This health check involves taking a history and doing a physical exam. So in terms of history, we will ask you some questions around your general health and any specific signs or symptoms you might have, such as chest pain, coughs or colds, any shortness of breath, any tummy pain, any pain in your muscles, joints or bones. And this will direct the physical exams that we do. So we'll examine your heart, your lungs, your tummy. We'll also examine your joints and bones. And then this will direct the investigations that we do, including blood tests. We'll get a blood test to look at your general health, as well as your cholesterol levels, your diabetes markers, looking at your thyroid function test and your liver function. And from here, we will make an overall assessment of your health and your readiness to take on any interventions and advice that we will provide you. We will also direct you to any specialists that you could receive some further help from. So this is the 45 to 49 health check. The second one I'd like to discuss is the healthy heart check. So the healthy heart check is targeted towards anyone that's age 45 or above. And if you're a Aboriginal or Torres Strait Islander background, it's targeted towards anyone that's 30 years old or above. It's just a 20-minute health check where, again, we do the same sorts of things. We ask you some questions through a history, we do a physical exam, we do some blood tests, and we'll do an ECG to get a quick snapshot of what your heart looks like right here, right now. So in terms of history, we'll ask about your cholesterol status, your diabetes status, whether or not you smoke, and your family history. And we'll do a physical exam like I mentioned before, and we'll do some blood tests again, looking at your cholesterol level, diabetes markers, etc. This is the healthy heart check calculator. So this is based on your gender, your age, your blood pressure, so the top number of the blood pressure, your smoking status, your cholesterol level, your HDL cholesterol, which is your good cholesterol, whether or not you have diabetes, and whether or not you have any abnormalities on your ECG. From here, what we do is we provide you some advice regarding risk factors. So, in terms of diet, we strongly recommend consuming a diet that's varied. It includes lots and lots of fruits and vegetables, nuts and seeds, legumes and beans. For those of us that are not vegan, we recommend eggs and low-fat dairy products. And those of us that are not vegetarian, we advise you to stick to lean meat, poultry, and fish. In terms of fats, we advise you to limit your foods containing saturated and trans fats, and keep your salt intake to less than 6 grams a day, limit your alcohol intake to 2 or less standard drinks per day, and keep your physical activity high up, at least 30 minutes most days of the week, if not every day. Keep your weight under a BMI of 25, and stop smoking altogether. And for those of us that need help with quitting smoking, the GP will provide you with recommendations such as the nicotine replacement therapy or any medications. So, what happens from here? The GP will start you on some interventions such as medications to lower your blood pressure, lower your cholesterol, manage your diabetes, as well as refer you on to any specialists that can help, such as a cardiologist for any heart conditions and endocrinologist for diabetes and any allied health members as well. Based on your risk level that was calculated on the Healthy Heart Check calculator, your GP will also advise you on how frequently they'd like to see you to calculate this risk factor. So these are some websites that I came across in my reading. My favorite one is the Healthy Recipes website, because I think I found some pretty good recipes there that I'm going to use at home as well. And if you guys have any questions at all, please feel free to contact me at my email address that I've left here. Always happy to answer any questions. Stay healthy, everyone, and see you later. Bye.
Thank you, Dr. Aishwarya, for your educational talk and for the time and effort put in. We will now have Suneek Sukhnandan. Suneek completed her podiatry degree at QUT University. She's currently working as a podiatrist in Toowoomba with a large group of podiatrists and other allied health practitioners enjoying her journey in a vibrant and busy practice. She has assisted at the Sai medical camps in India supporting senior podiatrists and surgeons. She's passionate about her work and sees Swami's feet in everyone's feet. Let's hear Suneek's advice on foot care and footwear. Her topic is Healthy Feet, Happy Feet.
Did you know each foot is made out of 26 bones, 30 joints, and more than 100 muscles, tendons, and ligaments, of which they all work together to provide the body with support, balance, and mobility? As a podiatrist, I look after people's lower limbs and feet. My job involves caring for patients with anything from painful feet caused by sports injuries, chronic conditions such as diabetes and arthritis, to skin and nail conditions, or working with people to improve their mobility and prevent falls. Treatment could range from general foot care and advice and footwear adjustments to custom designing and making orthotics and lower limb supports. Swami says, "Take one step towards me and I will take 100 steps towards you." Let's look at ways to better care for your feet to help you on your journey. Here are some advice and tips from your podiatrist to get you one step in the right direction at a time. Let's talk about balance and mobility. As you get older, side effects of medication and some chronic conditions such as Parkinson's and diabetes may increase your risk of falls. The importance of good footwear is greatly underestimated, not only in falls prevention, but also in preventing foot pain and injury. Good footwear provides your feet with stability, comfort, and also protection. Here are a few tips for you. Correctly fitting shoes. So you should always leave about 1.5 centimeters or a thumb's width between your longest toe and the front of the shoe. Also, having an adequate toe box size and shape and width. So your toe box is this front section of the shoe, so we do want to make sure it's an adequate width and the height of the shoe to compensate for any toe deformities, bunions, and any clawing of the toes, to make sure you have space for that. Worn out slippers are a definite no. They may be a favourite, but if they have any holes, worn out soles, frayed uppers, or broken down backs, it has to go. Slippers should be fastened, stay on, and provide grip. Avoid walking in socks on hard floors. There is a common myth which says that your balance is better when you are barefoot. This is false and can lead to a greater instability in your feet and is worsened when you're wearing socks. Having a firm heel counter is also quite important for stability, so that's the section right here at the back of the shoe. Having a firm twist, so you should not be able to twist your shoe through the middle. Fastenings such as laces, Velcro, and elastic also help to secure your foot into the shoe and protect the toes as well from sliding forward. The next one is especially important if you are at a higher risk of falls prevention, and that is having a low beveled heel. So this means having a rounded edge on the back of your shoes, which provides greater contact when your foot actually hits the ground and prevents you from slipping. That's this section here. Always wear socks as well inside your shoes for good foot hygiene. Podiatrists conduct walking or gait assessments, assess the movement in your joints and muscle strength, and can recommend a specific shoe or design a custom orthotic or insole for your feet to reduce foot pain and help improve your balance and mobility. Orthotics can be used to offload and take pressure off those painful hot spots, or calluses, corns, foot deformities, improve your body alignment, and improve your balance and mobility. If this is of concern to you, see your podiatrist for a full biomechanical or walking assessment. So this is what an orthotic looks like, and it's taken from a cast of your foot. So there's one made for each shoe, and it's used to provide your foot with greater support. So it slips into the shoe just like this. Foot, ankle, leg exercises can reduce your risk of falls and improve your overall health. Exercise improves your blood circulation, helps with weight loss, reducing the loads and stresses going through the feet, improves your general fitness and your emotional well-being. The Heart Foundation recommends 30 minutes of moderate exercise 5 days per week. This can be anything as simple as even walking. There are exercise classes available for all age groups. If you require specialized programs or muscle strengthening, such as after a surgery, you may require seeing an exercise physiologist or a physiotherapist. There are several chronic conditions podiatrists help to manage, including diabetes, in doing nerve and vascular assessments and offloading problem and high pressure areas of the foot, Parkinson's disease, in helping with balance, and rheumatoid and osteoarthritis, in offloading painful joints and other areas of the foot. One of the most common of these conditions is diabetes. Your feet are one of the first places to show signs of diabetic-related changes and complications, so it is important to pay special attention and care to them. Depending on your diabetic foot risk status, we recommend seeing your podiatrist for a diabetic foot health check every 12 months. But how does diabetes really affect the feet, and why is it so important to go for regular checkups? Having diabetes increases your risk of developing diabetic-related complications. This includes nerve damage, called peripheral neuropathy, or having a loss of protective sensation. This affects how you feel pressure or pain, and may lead to numbness or tingling in your toes or feet. Due to the nerve damage, your foot is unable to regulate the pressures in different areas and can cause ulcerations or breakdowns in the skin. Another complication is having poor and reduced blood circulation to your feet, referred to as peripheral vascular disease, which together with diabetes causes a delay in your ability to heal any cuts or wounds. This is a huge impact on your foot health and increases your risk of developing long-standing ulcers and if not managed appropriately, will lead to amputations. What are the signs and symptoms, and what should you do? Do you experience cold or burning feet, numbness, or a sharp pain in your legs after walking? Perhaps leg pain that wakes you up at night, or pins and needles, or have you noticed any changes in your foot color, such as maybe redness or a blue discoloration? Also looking for things like nail changes, corns, calluses, cracked or dry skin. Seek urgent care if you have any signs of an infection, such as redness or swelling, with or without pain, because remember, with nerve damage, you may not necessarily be able to tell that it's hurting until it's too late. What can you do? I believe diabetic complications are highly preventable with good care and management. Here are some general foot care advice for you. 1. Make sure your feet are clean and dry, including drying between your toes, especially after the shower. Moisturize your feet every day. 3. get into the routine of doing daily foot checks. This is to look out for changes in your feet and lower limb. You may need to use a mirror if you can't see the bottom of your feet, or get someone to help you if needed. 4. Keep your toenails trimmed or filed so they are slightly curved and just short of the end of your toe. As you get older, you may need to see your podiatrist to assist with general skin and nail care. 5. Never cut your corns and calluses with a razor blade or pocket knife. Don't use any over-the-counter products unless they are specifically recommended by your podiatrist, as they may cause more harm than good. 6. Avoid being barefoot, including inside the house. 7. See your podiatrist a minimum of every 12 months, and if you notice any changes to your feet, it is strongly recommended that you seek professional advice from your podiatrist or see a doctor sooner. To prevent any future problems from occurring, maintain good blood glucose levels, avoid smoking, and keep physically active. By taking the right steps in looking after your diabetes, these complications can be delayed or prevented altogether. Thank you for joining me to explore your foot health. Your take-home message is always wear good footwear, manage your diabetes and other chronic health conditions, and stay physically active. Podiatrists are an important part of your healthcare team. I recommend getting your feet assessed by a podiatrist at least once a year. Let's all take good care of our feet so that they can be as beautiful as our dearest Swami's feet.
Thank you, Sunit, for such a practical talk. Dr. Vasi is formerly from South Africa, with her undergraduate degree obtained in South Africa. She brings to our presentation today over 30 years of GP practice experience and expertise. She serves with love and compassion. Her topic is Osteoporosis, Stand Strong.
Hi Ram, I am Dr. Vasantha Naika, and I have the pleasure to talk to you about osteoporosis. As a GP of 35 years, I work a lot in aged care and am dealing with this condition on a regular basis. And only this week, I had a long conversation with a patient who sustained a fracture to the hip and arm following a fall. She was a fit and healthy busybody, taking care of her husband and grandchildren. Now she has to be taken care of and is constantly in pain. Osteoporosis is known as a silent disease because there are no symptoms or pain unless there is a fracture. Thus, this condition is under-recognized and the affected individuals are undertreated. On the 4th of June, 2003, our beloved Sri Satya Sai Baba sustained an hip fracture and needed surgery. He gave darshan from a golf cart while healing from surgery. More commonly, osteoporosis presents with a gradual height loss and with increasing thoracic kyphosis, which is an upper back deformity, and back pain with significant long-term disability. When bones have thinned excessively on a bone density scan, or when a minimal trauma fracture occurs, osteoporosis is diagnosed. There are several risk factors, being over 50 years of age, more in women than men. Genetics, a family history of osteoporosis is a risk factor. Decreasing hormone levels, menopause in women and low testosterone level in men. If you have a height loss more than 3 centimeters as you age, you're at risk. A low weight-bearing physical activity levels, low calcium and vitamin D levels, people from ethnic backgrounds such as Asian and Caucasian women, taking certain medications as steroids, breast cancer medications, being either very underweight or very obese, and other medical conditions such as thyroid disease, celiac disease, rheumatoid arthritis, chronic liver and kidney disease. We need to focus on education and awareness about the disease processes, prevention of osteoporosis, falls prevention, rehabilitation techniques. We need to optimize our nutrition with maintaining a healthy diet and a healthy weight. It's recommended that calcium intake, about 1,000 milligrams, and a good source of calcium includes milk, yogurt, cheese, almonds, leafy green veggies such as broccoli. Maintaining a good vitamin D level, supplementation is recommended if you are of Asian heritage. Vitamin D levels can be measured by your doctor if you're at risk. Important to ensure a half-hour safe sun exposure on a daily basis, face, neck, and arms. Bone is living tissues, and it gets stronger with exercise. So exercise regularly, walking, hiking, running, jogging, weight-bearing exercises, and resistance exercises, which is strength training. And important to avoid smoking and excessive alcohol intake. Many patients lose the ability to live independently following a hip fracture. It is essential to address the triad of osteoporosis, which is falls risk, impact of falls, management of nutrition, and vitamin D levels. And important to encourage safe mobility and exercise under appropriate supervision. It's an important statement. If you don't use it, you lose it. Reducing falls risk is important to create a safe home environment, minimizing medical factors such as comorbidities, medications, having too many medications on board are critical to reducing falls risk. Use of anti-osteoporosis medications are effective and are important in preventing fractures. The elderly may use hip protectors. Note that bones stop growing in the early 20s. Hence, the need on a continual basis for a good calcium intake and a healthy lifestyle is important to maintain the bone mass. Thank you so much. Sarah.
Thank you to Dr. Naicker for her illuminating talk today. Our next presenter for this program is Tom Atkins. Tom is a motivated and inspired professional that brings expertise from worlds of work with the Brisbane Lions AFL Academy as a physiotherapist and the Brisbane Roar FC as an exercise scientist. He works to provide exceptional rehabilitation of spine and shoulder-related injuries. Tom likes to promote health and well-being through safe and tailored exercise programs. Tom's talk today is on osteoporosis, balance and fall prevention, a physio perspective. Meet Tom, the physio next door.
Welcome everyone. My name's Thomas Atkins. I'm a physiotherapist and an exercise scientist, and I've been asked to give a talk today regarding aging, falls and balance from a physio's perspective. Now, I apologise that I can't be there in person. We can't all meet in person with these crazy COVID times, but I hope this slideshow is easy for everyone to follow and understand, and I have my contact details at the end of the slideshow too if anyone would like to get in contact with me regarding some of the issues that I will present today. So a little bit about me before I get started on the aging, falls and balance slides that I have to come today with this talk. So I'm currently a physiotherapist and exercise scientist, as I explained on the first slide. I work in a small little private practice currently in Southport on the Gold Coast. I have also worked with the Brisbane Lions AFL team, particularly working with the under-18s academy sides. But as a lot of you guys might be aware, during the COVID-19 crisis, the lower levels of AFL, especially their under-18 and junior academies, all had to stop. And due to the lack of funding, some of those jobs still haven't come back yet. I would love to get back to it in the future, but currently I'm really focused with my current role in the private practice in Southport, physio next door. So a little bit about us quickly. We work in partnership with leading specialists, particularly Dr. Matthew Scott Young, who is the president of this country in regards to spinal orthopedics, and also Dr. Angelo Rando, who is the president of Queensland for upper limb surgery. Now, with my work with Gold Coast Spine and Dr. Matthew Scott Young, and particularly spinal orthopedics, a lot of aging and disease topics have come to the forefront, particularly with my work with Matthew over the last couple of years, and particularly this year. And it was quite funny that I was asked to do this talk regarding aging and balance and also falls risk, because it's actually really come to the forefront in my work recently anyway. So a lot of these topics I've already been well equipped with and have been researching them a lot recently. So it's a really big passion of mine, this topic at the moment. So it's going to be quite easy for me to just show you what we're doing from our work-wise and then help give it to you guys in a patient perspective. So I'll start off with aging, and the main thing is bust the myths. You don't have to be chronologically old to be at risk of the things that are associated with aging and some of the myths associated with that. Age isn't the only factor when you're considering vulnerability. So I want to bring up the word and the concept of frailty with you guys. I've just screenshotted one of the main frailty papers that Gold Coast Spine, Dr. Matthew Scott Young, and myself and my clinic have really become aware of in the last couple of months. It was only actually published in April of this year. And I'm going to go through a couple of the things to really digest with this paper and the idea of frailty on the next slide. So as on the previous slide, I want to talk to you guys about the idea and concept of frailty. Frailty is a biologic syndrome characterized by high vulnerability to low pressure stresses, manifested clinically by decreased functional reserve and resilience together with multi-organ dysfunction. Now, frailty is associated with increasing disability, hospitalization, adverse health outcomes, and the very worst end of the spectrum, including death. But frailty is multifactorial, and chronological age is just one factor. So just how old you are numbers-wise doesn't mean you're frail if you're getting towards the big numbers. What your experiences during life, but also adverse health and diseases can also lead to someone becoming classified as frail. So things like diabetes, high blood pressure, surgeries, heart attacks, strokes, these sort of things are all factored in. And I've seen it a lot in my clinic, and so with Dr. Matthew Scott Young, in terms of surgery requirement and degenerative diseases becoming more prevalent at younger ages. Some as young as 40, you know. That's what I mean. I really have seen this in the flesh, that aging is becoming more of a myth. Is just how old you are means you're more set up or more at risk of adverse things happening, including falls and poor balance. Whereas it's really coming into research that is not the case. And that's what I mean by busting those myths. So some people that might be listening to this today, they may not be as old as they think they are, where they think this is you're at risk. And so it's really good to pay attention. So I'll now talk about the effects of aging on bones themselves. So I'm just going to try and explain to you how bones work. And the best way that I can explain it in layman's terms is like the game Pac-Man. So there's 3 types of cells within human bones. There's a builder cell, they're called the osteoblast. Then there is a demolishing cell, they're called an osteoclast. And then you've got the supervisor, if you call, and that's called the osteocyte. So there is a constant remodeling phase going on in the bone where the builder bone cell will be constantly trying to build bone, but then you've also got a demolishing cell that will always try and clean away bone and distribute it to somewhere else. And then the supervisor cell decides which one does more work. Is there going to be more building today, or is there going to be more demolishing and redistributing the bone somewhere else? Now, this balance changes with age. resulting in loss of bone tissue because the demolishing bone cell becomes more active and the builder cell becomes less active. And then the aging bone has a reduced mineral content and is prone to osteoporosis. And I'm sure a lot of you guys today have heard of someone that's had a fall and they've fractured their hip or they've fractured an arm, that sort of thing. And that's why people, as they get older, they're more prone to fracture. Whereas a 10 or 20-year-old, they have the same fall or even at a higher force and they don't fracture. And so that's what's going on with the bone on the inside. So osteoporosis is when the bone mineral density is at a critically low level and then a fracture is very likely with a small amount of force. And osteoporosis is driven by three main factors. One is an inactive lifestyle. Two is hormonal changes. So, for example, menopause. So, I'm sorry, ladies that are listening today, but ladies are at least a little bit more at risk because of those hormonal changes with menopause. And then a loss of calcium and other minerals in bone, which is just part of the aging process as well. And so when people become osteoporotic, this changes the posture, particularly of the spine, but also of the leg bones, that sort of thing. And then this can cause an instability and a loss of balance, and thus increasing the risk of fall. So you can see where the perfect storm is happening here, where you're getting bones that are weakening, it's decreasing your balance, and then you're at risk of a fall, and then that fall can then lead to a serious fracture because the bones are weak. So now I will talk about age and balance and the balance systems and how they work. So think of balance as three little systems inside your body, and those little systems are your ears, your eyes, and your joints and muscles. So I'll start quickly with your ears. Your ears have a little organ inside the ear canal called your vestibular system. Basically, the vestibular system is telling the brain at all times where you are in space and what direction you are in space. So are you standing up? Are you lying down? Are you turning? Are you moving? The eyes then are another system sending feedback and messaging to the brain. And they are telling you, are you still? Are you moving? Also, what direction you are in? So they're basically like a little backup mechanism for the vestibular system. Now, some of you guys today may have experienced vertigo before, and the people that have had vertigo before will know that's an absolutely horrible feeling. You feel like the earth is moving, you feel like you're constantly spinning, and it can make you feel quite nauseous. So vertigo is when the vestibular system can sometimes have an infection called vestibular neuritis, or there can be little crystals moving around inside the vestibular system and they become dislodged. So the last system for balance is your joints and muscles. Now, these are little receptors and little nerve endings in the joints and muscles that also send messaging to the brain about where the body is in space and where the body is and what it is doing. So when we think about balance and how to improve it, I always say to my patients, control the bits that you can control. So the eyes and ears degenerate with age. So the little cells within the eyes and ears slowly die at a quicker rate as we age. That's the unfortunate truth. But the muscles, the same thing can happen, but it can also be reversible with exercise. So now let's have a look at the effect of exercise on muscle and on bone, like I just showed before with the balance and also bone slides. So there is an age-old myth that as you get older, exercise can become more harmful, more risky, and just cause more harm, and it's not a good idea as you get older. And that is absolutely not the truth. At any point in your life, exercise is always a good idea. It's just about what sort of exercise that you do. And you can always modify the exercise to be more suitable to your hobbies, but also previous injuries, and also your energy levels. The main concept is make it fun, and I'll go through that in another couple of slides, but I just want to quickly show you what happens inside the body when you exercise and why it is a good idea for the entirety of your life in some way, shape or form. So if a lot of people you here that listening may have experienced performing like a big a heavy load of exercise, or they go for a big walk and they feel sore afterwards. They feel sore potentially the next day. They could feel sore for days after. And you go, what is that soreness? Is that damage going on inside my body? Is this bad for me? Well, I can answer that for you. A lot of the time, it's actually micro damage and stress. And that stress is caused on the muscles and on the bones. And it's actually microscopic bleeding of the muscle and bone. And this may sound horrible, but it is the best thing about exercise. As long as the muscle tear and bone bleeding isn't very big, and a lot of the time it isn't, what this causes is adaptation. So the body will go, hang on, we can't be tearing and bleeding every time we do exercise. So what we're going to do is we're going to make those tissues and structures stronger for next time. So the muscles, they lay down more muscle fiber, and the bone, they lay down more bone fiber, like those builder Pac-Man cells that I was talking about in the couple of slides before. They become really active after exercise. You want proof, you say. Okay, so now look at the couple of pictures on the right-hand side of the slide. Let's start with the first one on the left, which is comparing different aged triathletes, but also a male sedentary person that isn't performing as much exercise as they get older. So first of all is the 40-year-old triathlete. Now I'll just quickly run you through the diagram. The outside thin white layer is fat tissue. On the inside, the big bulky black tissue is muscle, and the little pearly white circle in the middle is his thigh bone. So the thigh bone in the middle, you can see, is nice white pearly color, but it's also really thick. It's got a lot of good quality bone, but it's also quite dense. Now the muscle, you can see, is also quite good in its performing action because it has barely any fat tissue around the outside, and it is good quality by how dense it is on the image. And you compare that to the one in the middle, who's a 74-year-old who isn't performing as much exercise. Now, there may be many reasons why. He may have previous disease, he may have previous injuries, he may be lacking energy. But you can see the effect where the fat tissue around his muscle grows in size and actually takes over where the muscle was in the 40-year-old triathlete. Now, the muscle isn't the same quality either because of the appearance. You can see it's quite shriveled up, and the fat is starting to infiltrate around the muscle too, with the streaks making it look like a Wagyu steak. Now, let's look at the 74-year-old triathlete, and you go, hang on, that looks a lot like the 40-year-old, and that is not a trick. That is the effect of exercise. Now, the bone is nice and thick in the middle and nice and pearly white, so it's good quality and good density. But also the muscles on the outside, the thigh muscles, are also quite dense and thick and good quality. So it shows that age is not just a number, and exercise can be done all throughout life. It's just about application, but also finding things that suit you. I'll quickly just run over the last picture there on the far right as well. And that's just showing the effect on bone with exercise too, just in a better quality image. So it's actually baseball pitches, and they did it in a study where they compared the non-throwing arm to the throwing arm. Now you can see how thick that bone is, and that's purely the bone responding to the stress and the force going through the arm when they throw the ball hundreds of thousands of times a year as their profession as a pitcher. Now that happens in all bones that are under stress and force. So you can imagine that's going to happen in the same thing in your legs when you go for regular walks and regular exercise with your legs, where you're constantly loading those bones through gravity. So how do you know if your balance is starting to become a problem? As I mentioned in a couple of slides before, as you get older, your eyes and your ears may start to deteriorate, and you may start to feel a bit more unsteady on your feet. But how do you know if it's starting to get a real problem and a real danger of falling? A couple of little things to look out for, some signs or symptoms that are quite generic but should be aware of. When you're walking around the house, do you feel more comfortable if you're holding onto something? This is commonly called furniture walking. So you may not be using a walking aid, you may not be using a stick or a wheelie walker, but you may be looking to hold onto the couch or the kitchen table or the kitchen bench as you're walking past, just for a bit more ease and steadiness. Or you may need to hold on to your husband or wife and partner when you're out and about. Sometimes also you might have already had a fall or a near miss where you've almost fallen and you've just stopped yourself. And then the other thing is also feeling unsteady when you're walking on uneven surfaces, for example, grass or sand, that sort of thing. These are little signs and symptoms that your balance is starting to deteriorate, and it may be a good idea to seek help, and particularly exercise for the muscles and joints. Like I said in a couple of slides before, the bits that you can control, while the ears and eyes are the bits that you can't control. So how do we control this, you ask? Well, I'm sure you probably would have guessed exercise is the correct answer, but it's a wonder and a question of what sort of exercise. I always say to my patients that I see in clinic for balance-related issues, it would be really silly if I gave you an exercise that made you fall over at home and promote the exact thing that I'm trying to prevent. So exercise for balance must be safe. So I just want to asterisk this slide and just provide a bit of caution that these aren't exercises that you should just go home and try out. A lot of them need to be validated by a physiotherapist in person to make sure these exercises are indeed safe for you and safe for your level of balance. If you've got very, very poor balance, these exercises shown on this slide may not be appropriate. These are purely just examples. So just quickly, I just want to show you the main idea with all these exercises. Is what you'll notice is they're all weight bearing. Okay, they're not lying down or doing little gentle strengthening exercises or using rubber bands or anything fancy. They're really simple, and they just work on the systems that I went through before. The muscles and joints in your legs, so they're constantly loading those areas with force. So it's causing those changes in the muscles and bones to become, the muscles to become more dense, but also the bones to become more thick. Now, not everyone today listening to this slideshow will have dramatically severe or deteriorating balance, but they may be noticing that it is starting to decline slightly and they want to take care of it before it gets worse. And they always say prevention is better than cure. So there's some easy and simple exercises and classes that can really help to slow down the process of your balance deteriorating. And I'll go through them now and some really helpful tips that, and also little clues and life hacks basically that are out in the community that a lot of you guys listening today may not be aware of. But first of all, I sort of alluded to it in a couple of slides, exercise should be fun. Always do something that you're really going to enjoy, because then it's more likely that you will stick with it and your motivation won't be a problem at any point with sticking to the exercise program and keeping it up and keeping those muscles strong and also your bones nice and dense and strong too. Because as soon as you stop exercise, it can still deteriorate the other way. It's the use it or lose it saying. So classes are a very good idea for balance, and a lot of the research has shown that classes, particularly Tai Chi, Zumba, those sort of things, are really beneficial as you get older, mainly because they're fun and motivating, but the actual moves and the dance moves and the sort of maneuvers that they perform in those classes are all in weight bearing, and so they really stick with the structural and pathological component of why balance improves with exercise and loading the bones and muscles with gravity. Now, the Brisbane City Council, I've just put up a little screenshot here just to give you guys some proof, but it's usually prevalent in any township or council that you guys live in. So not everyone listening today may live in Brisbane, some may live in the Gold Coast, Toowoomba, for example. I just would instruct you to look up your own local city council website. And a lot of them will run classes like shown on the slide for falls prevention, Zumba, yoga, also Tai Chi, with the exact goal for improving balance. Now you can see on the screenshot here, the falls prevention and strength class, but also the balance better and stay moving with Tai Chi, those classes are free. Now, this is just a little screenshot, and you'll see it shows you the locations of where they are and their dates. But I guarantee you, and I promise you, this page, I couldn't show all of it, but scrolling through, there was about 50 different classes going on in the city every weekend. So I guarantee there'll probably be one 5 minutes down the road from where you live. And they're a very good idea for just keeping your balance health nice and steady and preventing any further decline if you're starting to feel like you're becoming more at risk, or you just want to do some nice exercise and meet some new people. This is a fantastic idea. Now, alternatively, there may be some people listening to the slideshow today that believe their exercise is a little bit worse than first thought and may need a physiotherapist consultation and assessment before getting going on some balance exercises or attending a balance class. So I just want to let you in on a little secret that I find a lot of my patients in my clinic aren't aware of. That's a really good government-funded scheme for people in the community to attend physiotherapy in a cost-effective manner. So there's a thing in the community called an EPC care plan, which is fully funded by Medicare. And basically, all you need to do is go to your GP, state that you're starting to experience balance problems. They will know that you need a referral to a physiotherapist for assessment and potentially exercise programs to be provided. But if you ask for a chronic disease management plan, or really commonly called an EPC care plan, this will wipe a lot of the costs of those physio appointments. You get 5 sessions per year. They're funded under Medicare. It's for a chronic condition, so greater than 3 months, and balance problems are always chronic. They're always longer than 3 months. So EPC care plans are a fantastic idea for balance-related appointments. Now, these EPC care plans cover a lot of the costs for allied health related appointments. So allied health professionals include podiatrists, psychology, and also physiotherapy. And what it also causes, the EPC care plan, is a team management pathway where the GP and the physio then connect and talk. So I write letters to GPs all the time regarding EPC care plans to keep everyone on the same page, the patient, the GP, and myself as the physio. And it really enhances the quality of care for the patient, and it's a lot more cost effective, so I can't really see any negatives with this scheme. So for those that live close by on the Gold Coast, or anyone passing through the Gold Coast who would like to come and see me in my clinic, I've posted a map on the screen, but also my address, email, and phone number. Anyone that's accustomed to Southport and Southport Central, I'm across the road from the Southport Library in the Southport Central Towers. I would love to hear from some of you guys soon. If you do want to book an appointment, as you ring or email, just let my reception know that you found me through this Aging Falls and Balance talk, and I'll be sure to get you in quickly and soon, and I hope to see you guys soon. So that's all from me today. Thank you so much for listening.
Thank you so much, Tom, for your talk and the practical tips provided today. Now we will have Dr. Venkat Reddy and Virya Naikar, who will be giving us an insight into conditions affecting the eye. Their topic is eyesight. Dr. Reddy is a clinical lecturer at UQ, and Virya is an optometrist in private practice and graduated from QUT. Let's find out more about eyesight.
Om Sai Ram. Welcome to Eyesight, where we'll be looking at some conditions that affect the eye and the care of your eyes. My name is Venkat Reddy.
And my name is Virya, and we want to jump straight into it. The aim of this is really just to empower you so that you can better understand the eye. And the first thing that we do is look at the anatomy of the eye so you can understand exactly what can be affected in the eye. And if we start from the very front of the eye,
we can see that there's a lens, a cornea, and this part of the eye, there's only clear windows where light can just pass through right towards the back of the eye. At the retina level, we have the fovea or the macula, and this gives us all of our central vision. And then you have the optic nerve, mostly responsible for your peripheral vision. So the conditions that we will be talking about today will be affecting all these parts of the eye. And we're going to start from the front of the eye, working our way into the eye towards the back of the eye. So we have conditions like pterygium, presbyopia, cataracts, macular degeneration, diabetic and hypertensive retinopathy, and we're finishing off with glaucoma. So I'll let Venkat jump into pterygium.
Thanks, Rhea. So the first condition we'd like to look at is pterygium. What is a pterygium? It's a benign growth of tissue that grows across the front surface of the eye. As it grows, it can be a bit gritty, can be red, and can be a bit sore. But I want to emphasize that it is a benign condition. It is caused or associated with sun exposure. And in Queensland, especially, other parts of Australia, we have a lot of sun. And the UV part of that is associated with pterygium growth. So it's very simple. How to prevent or reduce the risk of pterygium progressing? You have or you wear eye protection or protection from the sun, from the ultraviolet rays. Sunglasses and a hat would be essential in the sun to reduce the risk of pterygium.
So as we move further on into the eye, we can talk about the lens, which is another clear window in the eye. And it's basically your eye's personal camera. This lens is flexible. It's able to focus on things far away, near, and anything in between. As we get a bit older, this lens is going to lose its flexibility and it becomes harder to see things that are close to you. So suddenly you're pushing your arm out to get things a little bit clearer. And this typically happens around the age of 40, where that lens begins to lose its flexibility. It is unpreventable and completely normal. A very simple solution: head into your optometrist. We'll probably fit you up with a pair of reading glasses to make things up close really nice and clear. And if you wish to be spectacle free, we can even look at contact lens options. The same thing with cataracts. This is affecting that lens within the eye. So once that lens has completely lost its flexibility, it's typically crystal clear like water. And as we get a little bit older, it's changing color and it becomes a little bit more cloudy. Now, in the early stages, you begin to get a bit of reduced vision. There's nighttime glare. Things just aren't as clear as they used to be, because obviously you're looking through a cloudy lens compared to a crystal clear lens. We can update your prescription to make things a little bit clearer, but at the end stage of the cataract, so when that lens is just too cloudy, we go for the most common surgery in the world, cataract surgery. So that's where we'll send you to the ophthalmologist. They're going to remove that cloudy lens and insert a crystal clear lens, and that should restore all of your vision.
That's right, Rhea. The cataract surgery is really one of the most common operations done in people, certainly in eyes. Now let's go to the back of the eye, to the retina, and look at age-related macular degeneration. And on the right of the screen, you'll be able to see what a dry age-related macular degeneration is. There are two types of macular degeneration, wet and dry. And macular degeneration affects the central vision of the eye. It affects the macula, which is responsible for central vision. And what happens there is that certain waste products start accumulating there, and that degrades the vision in the middle part of the eye. What we wanted to leave you with on macular degeneration is that it's very important to have a healthy diet which is rich in antioxidants. That's your best chance really of delaying or reducing the risk of dry macular degeneration being converted into wet, which can take away your vision relatively quickly. So the best thing to do is to have regular eye exams where the retina is examined by your eye healthcare professional. And of course, if there are any other health conditions that you have, to manage those. Those are really your best bets in dealing with age-related macular degeneration. The next condition is diabetic and hypertensive retinopathy. Retinopathy meaning damage to the retina, or a disease of the retina, which can be caused by high blood sugars, diabetes, or high blood pressure in hypertension. What happens with these two conditions is that they damage the blood vessels in the retina, in the back of your eye, and that results in proteins and other substances which are inside blood vessels leaking into the retina. Retina is essentially nervous tissue or nerve tissue that collects the light and to send it back to the brain so that we can make sense of the world. So if those products are in the retina, it will reduce the sensitivity of the retina to light. Blood can leak out as well. So the main takeaway message here is that it's very important to control our blood sugar levels and our blood pressure. If we're diabetic, to control our blood sugar levels, and if we're hypertensive, to control our blood pressure. And a lot of people have both conditions together, diabetes and blood pressure. It's very important to control both of those things. And again, as part of looking after yourself generally, healthy diet and exercise, have regular checks with your GP so that your sugar and your blood pressure can be monitored. And of course, having an eye health professional look at your eye on a regular basis so that if these conditions arise, they can be picked up early and we can give you advice on reducing the progression, treating the condition as if it turns up. Now, let's have a look at what this looks like. As I mentioned, it's about damaged or abnormal blood vessels. And there are those abnormal blood vessels. What happens is they start to leak substances into the retina. Cotton wool spots happen when the blood supply to the retina is reduced. Exudates, etc., are substances which leak out of the blood vessels into the retina. So these are some of the things that can happen, particularly with diabetic retinopathy. Now,
I guess it's so important.
Which is glaucoma.
Yeah, I guess it's so important that you said regular health checks and eye checkups need to be done, because glaucoma is one of those things that requires just that.
Absolutely.
Glaucoma affects the optic nerve, and the nerve is responsible for your peripheral vision. So glaucoma is a condition where the seemingly healthy nerve begins to thin down. So if you look at the top image here, that is what we would call a very healthy nerve. It's got this lovely pink color. The nerves are coming, the vessels are coming out from the very center of the disc. As you go to the next image, there's a little bit more of that yellow in the very center and what we call the cup. And that's the paler area. And that shows that the nerve is getting thinner and thinner to the point where the next image, it's what we called cupped out. So that pale yellow color, that waxy appearance, and the vessels just on the very edge of that cup, it's not good. The nerve is totally thinned out, and this can result in irreversible vision loss. Typically, it starts in your peripheral vision, and there's a tunneling effect. And at end stage, you will have lost your central vision as well. So the importance of checking the optic nerve. Make sure you're asking your optometrist or ophthalmologist, is my optic nerve healthy? Typically, glaucoma is associated with higher intraocular pressure. So even ask those questions. Is my eye pressure okay? Is it within the normal limits? So if we go over to the next kind of slide, we can get a bit more of an animation of what glaucoma really is. So there's the optic nerve. And then just above that, you've got your visual field. So that's your peripheral vision. Now, as you're missing your checkups, the visual field is starting to shrink. The nerve at the bottom is beginning to cup out and thin to the point where you've missed all your checkups and now you've lost your vision. So just reiterating the importance of going into your optometrist or ophthalmologist so that they can check the health of the optic nerve so we can preserve your vision through medications and other forms, other treatments.
So the key really there is to have regular eye checks.
Absolutely.
So any deterioration in that nerve gets picked up.
Yeah.
Excellent. Great point there, Ray.
And then we go straight onto the emergencies. This is the most important thing, because too often do we see, these sudden onset of symptoms delayed. And, vision loss can occur quite quickly if you don't actually treat them. So the key word here is sudden. If it's a sudden onset of something, you go into your eye health professional. If you're getting any vision loss, any sudden double vision, flashes of light in your vision, like a camera flash or a lightning bolt, floating patches like these black, I call mine fruit flies because I've got a couple of floaters that are quite chronic, and severe eye pain that's persistent, not being helped by any rest, redness in your eye that's suddenly there, any injury, whether it be a physical blunt trauma, or any chemical cleaning products into your eyes. Don't delay. Just go into your nearest eye health professional so we can make the decision on what to do with your eyes. And I guess I want to stress the importance of seeing your eye health professional, because we do have equipment that's better for your eyes, where sometimes other health professionals will not have the equipment that we have to triage you appropriately.
That's a really good point, Maria, because as the title says, emergency. It's an acute situation which requires someone to qualify to have a look at it and take the necessary steps to preserve your vision. And the other thing I wanted to emphasize here is that last bullet point about chemical or physical injuries. When we're working with chemicals, when we're out there, it's always very important, gardening or any other activities, to wear eye protection so that we reduce the risk of those things happening. Very, very good advice there on ocular emergencies. Right, well, I think that's pretty much the conditions that we had in mind. Who's ready for a quiz?
Me. Pick me.
Let's see if you've been paying attention, Varaya. Let's see.
I'm there.
If you've been really with us. Okay, you can play at home as well. So,
make it rapid.
Okay, here it comes. Here it comes. Here's the first question. True or false? Sunglasses and a hat can reduce the risk of a pterygium. True or false?
Absolutely true.
Oh,
absolutely.
I'd have to agree with that. UV light, sunlight is the main risk factor, isn't it? So keep it off your eyes and all around your eyes, actually.
We really do underestimate UV protection in Australia. It's just so harsh.
That's
you have
right.
to.
And anyway, we're here, we enjoy the sun. Of course, we love going to the beach, we love being in the garden and playing sports, etc. But wear that sun protection and reduce the risk of pterygia growing.
Yeah.
Next question. At around what age does presbyopia commonly begin? Is it 18? Is it 30? Is it 40 years of age or 60 years of age?
I love how you put around in there.
Around,
because it's definitely around 40, because it can be a little bit before, a little bit after, but generally around that age, we start to have a bit of trouble with reading and things that are fine print, really.
And you start to do this sort of thing.
Oh, yeah.
So your 18-year-olds can rest easy for now, and your 60-year-olds, you've probably been experiencing it for a few years, and you probably have lenses to help you correct your presbyopia. Now the next question, what part of the eye does a cataract affect? Is it the retina? Is it the optic nerve? Is it the cornea or the lens, or which part is it?
We're definitely going for the front of the eye, because the cataract affects one of the clear windows. So we'll go into the middle of the eye. It's the lens. The cataract affects the lens.
I have to say that is 100% correct. Well done, Vera.
Brilliant.
Next question. I love this question. There are 3 types, true or false? There are 3 types of age-related macular degeneration: wet, dry, and driest. True or false?
I would be fired if I told my patient, you have driest AMD.
Driest. Yeah. So
no, false.
False. That's false. Of course, there are 2 main types, wet and dry. And if you've got driest, well, it's probably just dry.
You can't get any drier than that.
You can't get any drier.
Dry.
Driest. Okay, next question. What must be controlled to reduce the risk of diabetic or hypertensive retinopathy? Is it A, blood sugar levels? B, is it your blood pressure or hypertension? Is it C, nothing, can't be controlled, you have to live with it? Or D, A and B, or E, the weather?
The weather. Obviously, it's the weather.
Right. Have you tried controlling the weather, Varaya?
Look, it's a bit hard, so I'm going to have to go with A or B, because I guess the answer's in the question.
Yeah. Diabetic, blood sugar levels. Hypertensive, blood pressure. So A and B is the correct answer. Well done, Varaya. Well done. I'm very proud of you.
I'm nailing it.
And here's the next question, and the last question we've got. Glaucoma affects what part of the eye? Is it the retina? Is it the cornea? Is it the lens? Is it the optic nerve? Is it the iris? Which part of the eye is affected by glaucoma?
Give me a tick for the optic nerve.
Oh, you certainly get a tick for the optic nerve. Well done, Varaya.
Thank you.
I think you've actually gotten 6 out of 6. Well done. I hope you have been empowered by that.
Thank you.
Well done. Well done. You should be feeling a bit more empowered and a bit more confident about your eye and about the conditions that affect the eye.
Absolutely.
So this is the end of our webinar. We'd like to leave the last word to Bhagwan Shri Sathya Sai Baba and thank you for participating in this webinar. Hope you got something out of it. Thank you, and it's Om Sai Ram from me.
And Om Sai Ram from me.
Thank you to all our inspiring health professionals who have given up their valuable time to make this event possible. I am sure you will agree that we have all benefited from the information provided today. Remember that the health information provided is of a general nature, and we recommend that you contact your health practitioner for more personalized advice to suit your individual needs. If you need any further information from our presenters, please send your comments and questions to the email address provided at the end of this presentation, and we will get back to you as soon as possible with a response from them. I hope you have enjoyed this healthy aging webinar today. Thank you for your love and support. Om Sai Ram.
राधे कृष्णा जय श्री कृष्णा राधे राधे कृष्णा जय श्री कृष्णा राधे कृष्णा जय श्री कृष्णा जय श्री कृष्णा राधे राधे कृष्णा जय श्री कृष्णा राधे कृष्णा जय श्री कृष्णा राधे Krishna जय श्री कृष्णा राधे 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 कृष्णा जय श्री कृष्णा राधे 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 कृष्णा राधे 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 कृष्णा राधे राधे जय श्री कृष्णा राधे राधे जय श्री कृष्णा राधे 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 कृष्णा 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 जय श्री कृष्णा राधे राधे शिरडी कृष्णा परती कृष्णा साई कृष्णा राधे राधे कृष्णा परती कृष्णा साई कृष्णा राधे 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 कृष्णा जय श्री कृष्णा